Hello and welcome to the State of 911 webinar series hosted by the National 911 Program. My name is Brian and I'll be the moderator for today's session. This webinar series is designed to provide useful information to the 911 community on the advancement of 911 across our nation. The National 911 Program strives to bring you federal, state, and local leaders in public safety to share valuable information with the community. It includes real experiences from leaders utilizing these processes throughout the country. In today's session, you will hear the FCC provide an update on 911 related activities from the past year. Also, members of the Coastal ESInet Cooperative will discuss their shared ESInet and methodologies for sharing services across the member agencies. For closed captioning, hover at the bottom of the Zoom screen for meeting controls and click the CC button to start viewing the captioning. For more information on the National 911 Program webinars, access to archived recordings, or to learn more about the National 911 Program, please visit 911.gov. Feedback or questions about webinars can be sent to nitsa.national911@dot.gov. Slide. The National 911 Program would like to make you aware of the Documents and Tools section of the 911.gov website, which has been updated with new resources and improved access. 911 stakeholders are encouraged to submit links and documents that would be of use and interest to 911 colleagues, including policy documents, plans, and reports across several topics such as government, management, technical, operations, and standards and best practices. You may access the web page under the 911 Systems Resource drop-down menu or scan the QR code in the bottom right corner of this slide. Content can be submitted by clicking the online submission form on the lower left side of the Docs and Tools page. The National 911 Program would also like to invite you to visit the 911 Telecommunicator Tree of Life and share the name of a remarkable 911 telecommunicator who has inspired you. You can share their story at 911treeoflife.org to honor a special 911 telecommunicator who is making a difference in your community. Please note that all participants' phone lines have been put in a listen-only mode and this webinar is being recorded. You will have an opportunity to ask questions of the presenters at the end of their sessions, and we will guide you through that using Zoom's QA feature located on the bottom of your screen in the meeting controls. You can enter your question at any time during the presentation and it'll be entered into the queue. Hover your mouse over the bottom of the page to access the meeting controls, or to ask your question live, use the raise hand feature to request your phone line be unmuted and you will be called upon to ask your questions. Individuals registered for this webinar will receive access to today's PowerPoint presentation and a webinar recording. With that, I'd like to introduce our first speaker, Jill Coogan. Jill Coogan is an attorney advisor with the Policy and Licensing Division in the FCC's Public Safety and Homeland Security Bureau. Jill specializes in 911 related issues, including 911 fee diversion. Jill, I'll turn it over to you.
Hi, I'm unmuted now, I hope.
Yes, you are.
Excellent. Thank you so much, Brian. Hi, everyone. I'm Jill Coogan, and I'm an attorney advisor in the FCC's Public Safety and Homeland Security Bureau. Next slide, please. Today, I'll provide an update on recent Commission actions on several critical 911 and related issues, including recent proposed rules that should help 911 calls reach the right PSAP for the caller's location and help PSAPs receive timely and actionable information about 911 service outages. I'll also be talking about the upcoming 15th annual 911 fee report. Next slide, please. First, let's discuss the December 2022 item released by the Commission on Location-Based Routing, or LBR, for wireless 911 calls. LBR is a technology that uses precise location information available from the wireless handset instead of the location of the cell tower to route wireless 911 calls and texts. In June 2022, the Commission adopted a public notice to update and refresh the record in our LBR proceeding. We invited parties to provide the latest information on improvements to location-based routing and the deployment of such technologies on wireless carrier networks. We received some very interesting comments in response to our PN. First, the record confirmed that switching from tower-based routing to LBR could have enormous public safety benefits. One commenter estimated that if LBR were fully implemented nationwide, it would reduce by more than 20 million annually the number of wireless 911 calls that have to be transferred from one PSAP to another. Second, the nationwide carriers confirmed that LBR is being deployed, though not uniformly. AT&T has moved the fastest and states that it now uses LBR to deliver 911 calls and texts to nearly all PSAPs nationwide. T-Mobile has deployed LBR to 770 PSAPs, including some in Texas and Washington state. According to its initial comments to the LBR Notice of Proposed Rulemaking, Verizon expected to have LBR available for requesting PSAPs in late March of this year. Our third takeaway from the record was that public safety widely supports requiring nationwide implementation of location-based routing. The record also indicated that carrier deployments already had a positive impact on reducing misroutes. In December 2022, the Commission released a Notice of Proposed Rulemaking, or NPRM, for LBR. Citing the record generated by the June 2022 public notice, the Commission proposed in the NPRM to require commercial mobile radio service, CMRS, and covered text providers to deploy technology that supports location-based routing on their Internet Protocol, or IP-based networks, use location-based routing to route all 911 voice calls and texts originating on their IP-based networks when caller location information meets certain proposed baseline requirements for accuracy and timeliness, use best available location information, which could be longitude, latitude of the cell tower, to route 911 voice calls and texts from IP-based networks when caller location information does not meet the proposed baseline requirements, and deliver 911 calls, texts, and associated routing information in IP format upon request of 911 authorities that have established the capability to accept NG 911 compatible IP-based 911 communications. A link to the December 2022 LBR NPRM can be found on the slide. The comment and reply comment period closed in March, and we received many thoughtful comments. The proceeding is now pending. Next slide, please. Now let's turn to wireless location accuracy. The Commission adopted the current location accuracy rules in 2015, setting multi-year timetables and compliance dates for wireless carriers to deploy improved location technology for 911 calls, with particular focus on indoor calls. The rules included requirements for both horizontal and vertical accuracy. Now, 8 years after the rules were adopted, most of these compliance dates are behind us. This slide summarizes the current requirements for wireless horizontal and vertical accuracy and for dispatchable location. On the horizontal accuracy side, all carriers must deliver 50-meter horizontal accuracy for at least 80% of wireless 911 calls. On the vertical accuracy side, the nationwide carriers must meet a Z-axis location accuracy metric of plus or minus 3 meters relative to the handset for 80% of indoor wireless 911 calls, to be validated through testing of technologies in the industry test bed. As an alternative to providing coordinate-based location, carriers may provide dispatchable location. Dispatchable location is the gold standard for location information. The validated street address of the 911 calling party, plus additional information such as suite, apartment, or similar information necessary to adequately identify the location of the caller. Under our rules, dispatchable location is preferred. Carriers must provide DL if it is technically feasible and cost-effective to do so. At the bottom of this slide, there's a link to a summary of wireless E911 location accuracy requirements. Next slide, please. Now, let's discuss location deadlines for other technologies besides wireless. Under Section 506 of BAUM'S Act, enacted in 2018, the Commission was required to adopt rules to ensure that dispatchable location is conveyed with 911 calls to dispatch centers, regardless of the technological platform used. The Commission adopted dispatchable location requirements for certain multi-line telephone systems, or MLTS, fixed telephony, VoIP, telephone relay services, or TRS, and mobile text. The dispatchable location rules differ depending on the particular service and whether the device used to make the call is fixed or non-fixed. A summary of the regulations is available at the address at the bottom of the slide. Next slide, please. The rules for fixed devices, which cannot be readily moved from one location to another, require provision of automated dispatchable location with each 911 call. The rules for non-fixed devices, also described as mobile or nomadic devices, which can be readily moved by the user for use at multiple locations or while in motion, require the provision of automated dispatchable location with each 911 call if it is technically feasible, and the provision of alternative location information if automated dispatchable location is not technically feasible. Next slide, please. Now let's turn to the FCC's annual 911 fee report. The New and Emerging Technologies 911 Improvement Act of 2008, also known as the NET 911 Act, requires the FCC to submit an annual report to Congress on collection and distribution of 911 and enhanced 911 fees and charges. Since our first 911 fee report in 2009, the FCC has issued 14 911 fee reports. Our annual report is due to Congress by December 31st of each year, and each annual report contains state-by-state data for the prior calendar year. A major focus of the FCC's annual 911 fee report is the issue of 911 fee diversion. In other words, each year, the FCC analyzes how each state has allocated and spent the 911 fees it collected during the year in question, and whether the state has diverted the 911 fees to non-911 related uses. If the state has diverted 911 fees, the FCC designates that state as a diverter for the relevant calendar year. In addition to fee diversion analysis, the annual report includes state-by-state data on, for example, 911 call volumes, the number of PSAPs, 911 expenditure categories, implementation of next generation 911, and 911 cybersecurity expenditures. Next slide, please. The FCC issued its 14th annual 911 fee report in December 2022. You'll notice here at the bottom of the slide, we list the FCC webpage where you can view all the FCC's annual 911 fee reports and also each state's 911 questionnaire response for each year. Fee diversion is a significant problem in the United States. Each year, the FCC annual 911 fee report identifies a number of states as diverters, and a few states persist in the practice year after year. The 14th report found that in calendar year 2021, 3 states had diverted 911 fees: New York, New Jersey, and Nevada. All 3 of these states were also designated as diverters for calendar year 2020 and in multiple prior years. Meanwhile, the 14th report found that 2 states that had been designated as diverters the prior year for the 13th report, New Mexico and West Virginia, were no longer diverters in calendar year 2021. The 14th annual report found that in calendar year 2021, the 3 diverting states diverted a total of approximately $198.4 million, or approximately 5.68% of all 911 fees collected by all states and jurisdictions in 2021. From 2012 to 2021, states and jurisdictions diverted approximately $1.88 billion in fees collected for 911 and E911. The 14th report also included a new section on underfunding of 911. Many responding states and jurisdictions reported that underfunding results in degradation of 911 service and staffing challenges at PSAPs, and that underfunding contributes to delays in 911 system maintenance and equipment replacement, and delay in deployment of new technology such as NG911. Next slide, please. Now let's take a look at FCC data collection for the annual 911 fee reports and some tips for completing the FCC's annual 911 fee questionnaire. Each year, the FCC sends out a detailed form to 56 US states and jurisdictions to collect 911 fee data for the prior calendar year. This year's 15th questionnaire was sent out in early April and is due June 30th. Here are some tips for filling out the annual questionnaire. These tips focus on some common issues. Please use the word fillable form questionnaire that we provide. This allows us to automatically and efficiently import the data into our system. Please do not try to alter the form or turn it into a PDF. When states do this, we have to ask them to resubmit on the appropriate word fillable form. Also, many states submit the appropriate word form, but also submit a PDF copy of the same document. There is no need to include a PDF copy, and we prefer that states not do so, as this requires us to compare the two to make sure they're identical. Next, only report calendar year data, not fiscal year data. Also, when the questionnaire asks for a numerical response, such as the total number of primary PSAPs or the cost to provide 911 service, please provide only a numerical response or a short non-numerical response such as unknown, none, or N/A. Don't include any narrative explanation or qualifier such as approximately $4 million. Instead, put that in the related addendum section box on the form. It's fine to use dollar or percentage signs, decimal points, and thousand separator commas in your numeric responses. However, to facilitate the Bureau's calculations for the annual fee report, please avoid stray characters such as asterisks, parentheses, or brackets in your numeric responses. And here are two big tips. First, states should submit a single questionnaire form for the entire state, not multiple FCC questionnaire forms completed by counties or local jurisdictions. Second, states should include all requested data on the questionnaire itself, not just attach or refer to supplemental materials that may possibly contain some requested data somewhere within them. States may submit supplemental materials as long as the questionnaire form itself contains all requested data. Next slide, please. In 2023, we look forward to the continued work of the Communication Security, Reliability, and Interoperability Council, CSRIC 8, an important cybersecurity and network reliability partnership. CSRIC is a federal advisory committee that will provide recommendations to the FCC regarding best practices and actions the FCC can take to ensure the security, reliability, and interoperability of communication systems. CSRIC 8 is co-chaired by the CISA. CISA leads the coordinated national effort to enhance the security, resiliency, and reliability of our cybersecurity and communications infrastructure. CSRIC 8's agenda also reflects a 5G focus. 4 of CSRIC 8's 6 working groups are exploring the security and resiliency of Open Radio Access Network, RAN, leveraging virtualization technology to enhance network security, technical issues involving the security of 5G signaling protocols, and the software side of supply chain security. In March, CSRIC 8 adopted reports and recommendations from its working groups on 911 service over Wi-Fi and leveraging mobile device applications and firmware to enhance wireless emergency alerts. At the bottom of this slide, there's a link to CSRIC 8's homepage where you can learn more about its work. Next slide, please. On April 12, 2023, in honor of National Public Safety Telecommunicators Week, FCC Chairwoman Jessica Rosenworcel sent a formal letter to the Director of the Office of Management and Budget, OMB, reiterating her support for the reclassification of public safety telecommunicators as first responders in the standard occupational classification system. This is the second letter that the chairwoman has sent to OMB urging reclassification. Historically, 911 professionals have been classified under the standard occupational classification system as an office and administrative support occupation. Chairwoman Rosenworcel noted that 911 operators are among our most essential first responders, and they do far more than answer 911 calls or passively receive information. As 911 communications technology evolves, the role of the public safety telecommunicator is expanding to include integration and analysis of multiple sources of information to determine the appropriate response to any given emergency. Chairwoman Rosenworcel highlighted some states' recent actions to define first responder to include public safety telecommunicators, and stated that the Commission would welcome the opportunity to collaborate with OMB on this issue. You can view the letter at the link at the bottom of the slide. Next slide, please. On July 16, 2022, 988 was launched as the 3-digit nationwide phone number to connect directly to the 988 Suicide and Crisis Lifeline, which provides 24/7 confidential support to people in suicidal crisis or mental health-related distress. The Commission's rules require all wireless and wireline carriers, interconnected VoIP providers, and one-way VoIP providers to route calls to 988. In addition, the rules require covered text providers to route text messages to 988. By calling or texting 988, individuals can be connected with mental health professionals at one of more than 200 crisis centers across the country. Since July 2022, the 988 Lifeline has received over 2 million calls, texts, and chat messages. The Department of Health and Human Services Substance Abuse and Mental Health Services Administration, or SAMHSA, manages the Lifeline in partnership with the Department of Veterans Affairs, the VA, which manages the Veterans Crisis Line. All 988 calls and texts are routed to the nearest crisis center based on the caller's area code. Geolocation services are not enabled for 988 as they are for calls to 911. A caller's location information is not transmitted with a 988 call for possible dispatch of emergency services. The Lifeline automatically routes calls by area code to the nearest crisis center for that area code. For example, when a caller with a Virginia 703 area code calls 988, the Lifeline will route the call to a Virginia Lifeline call center, regardless of the caller's current location. In January 2023, the FCC released an NPRM proposing outage reporting requirements for 988, similar to those that currently apply to 911. The NPRM can be viewed at the address at the bottom of the slide. Comments were due by May 8th, and reply comments are due by June 6, 2023. Yes, next, yes, thank you. In addition, the FCC recently completed another proceeding concerning providing notice of outages, but this one addresses notifications that carriers are required to provide to PSAPs when 911 outages occur. For some time, the Commission's rules were somewhat confusing because there were different requirements for covered 911 service providers who serve PSAPs directly and originating service providers, wireless, wireline, and VoIP carriers that individuals use to call 911. On November 17, 2022, the Commission adopted rules to improve the framework for reporting network outages that potentially affect 911 service by harmonizing requirements for covered 911 service providers and originating 911 service providers, including the means, timing, and frequency of providing notification. The updated rules will standardize the type of information included in the notifications and ensure that the information is clear and actionable regardless of where in the call processing network an outage occurs. The updated rules require service providers to maintain up-to-date contact information for the 911 call centers they serve. PSAP should contact their providers with contact information rather than simply submitting contact information changes to the FCC. In addition, the Commission retained its current requirement that covered 911 service providers file annual 911 reliability certifications, which will help the Commission promote the continuity of 911 service during the transition to next generation 911. Next slide, please. Finally, let's turn to NORS-DERS. The Commission has adopted a program to allow for NORS-DERS information sharing. The Bureau has for years operated two systems that communication service providers use to report outage information. The Network Outage Reporting System, or NORS, covering blue sky outage reporting, and the Disaster Information Reporting System, or DERS, which is used to report service status during a disaster. Historically, during disasters, we have shared outage information with FEMA and CISA, who are within the Department of Homeland Security. But until a few months ago, we did not share NORS or DERS information with other federal agencies or with state, local, tribal, or territorial agencies. This has now changed. Last year, the Commission adopted new information sharing rules, which went into effect September 30th of 2022. Under the new rules, the FCC will share read-only access to NORS and DERS reports in real time with federal, state, territorial, and tribal nation public safety agencies, including state 911 authorities, to improve their situational awareness. To participate in data sharing, the public safety agencies must complete an application and certify that they will maintain data confidentiality and security, basically the same rules that the FCC applies to its own handling of the data. This slide has a link to our webpage with further details on how to apply. In general, states and other agencies that obtain approval will receive NORS-DERS data relating to events that occur within the state or agency's jurisdiction. The rules do not extend direct information sharing to local governments or agencies, but the federal, state, territorial, and tribal nation public safety agencies can share data with downstream recipients, for example, local emergency agencies, on a need-to-know basis, as long as those local authorities also certify in writing that they will comply with the same confidentiality safeguards applicable to the upstream agency. Next slide, please. Thank you for inviting us to speak with you today on these critical issues related to 911 and other public safety matters. We look forward to your questions now.
Jill, we do have a couple questions for you. The first question in the chat is, will the term next generation 911 be included in the annual 911 report? I believe that's the fee diversion report they're asking about.
I'm so sorry. Could you repeat the question? And let me actually back up for a second to say, I believe David Firth, who is a Deputy Bureau Chief of the Public Safety and Homeland Security Bureau, is also on hand to answer questions.
Yeah, I'm here. Hopefully everybody can hear me. I don't have my mute button on.
Yes, David, I can hear you, and I assume everyone else can too. Thank you.
Okay.
Can you repeat?
It actually could you repeat the question?
Sure. The question is, will the term NG 911 be included in the annual 911 report?
Well, we ask questions in our annual data collection about expenditures on next generation 911, and so the states that respond to the survey provide us with specific responses on what amount of 911 funds they're using on NG 911 related expenses, and that is something that we have reported in past reports and will continue to report in future reports.
Okay, very good. We may not get through every questions at this point, but I do see a hand up from Kimberly Stewart. Do you still have a question? No. Okay, so
Sorry.
oh, go ahead.
No, I said I do not. I apologize.
Oh, no worries. Okay. The next question we have is, when do we think geolocation will be required for those 988 and crisis line calls?
That is still to be determined as to whether there will be a geolocation requirement and how it will be, if there is one, exactly how it will be configured. I don't think that decisions on that are going to be made in the immediate future, but that's an issue that we're continuing to look at.
Okay, we have a variety of other questions that just popped in, but we are going to have to move on to our next presenters. We will work to get these questions answered and posted as part of when this webinar is available online. That is one of the things that will happen. This webinar and all the information, the slide deck will be posted online. So thank you, Jill. Thank you, David, for coming on and answering questions. Really appreciate your time and great information today.
Thank you so much for having us.
Indeed, thank you. And we'll look forward to responding to the additional questions when you forward them to us.
All right, thank you very much. All right,
Okay,
next,
take care.
I would like to introduce our next speakers from the Coastal ESInet Cooperative. They are early adopters in our field of 911. First is Sam Gaither, Communications Chief with Berkeley County 911. Jim Lake, Director, Charleston County Consolidated Dispatch Center. Matt Hibler, Charleston County Consolidated Dispatch Center, and Lori Woods with Horry County's 911. So I will turn it over to Sam to inform everyone about their Coastal ESInet Cooperative.
Hey, thank you, Brian. Sam Gaither here. This is our agenda for today. And since we're a little short on time, I'm gonna go ahead and pass it over to Jim. Next slide, please.
Next slide, Sherry. So the map in front of you really shows the coastal area of South Carolina. It's not inclusive of all the coastal partners. However, it gives you a geographic view. You can see from Horry County to Georgetown, all the way down to Jasper. That makes up our coastline. In the coastal cooperative partners at this time are Horry County, Berkeley County, Charleston County, Beaufort County, as well as the town of Somerville and the city of Goose Creek. We make up that coastal cooperative, and as you can see, that's why we named it the cooperative. Between the cooperative members, we provide services to about 25% of the state's population and responsible for over 21% of the 911 calls last year. Next slide. So we decided to form this cooperative primarily to assist each other with automatic mutual aid. So we have a formal intergovernmental agreement that's signed by our governing bodies. So this will certainly outlive my time here, as well as maybe even Sam's time. This is not a handshake agreement. This is a formal intergovernmental agreement. Based on that intergovernmental agreement, we have automatic aid, mutual aid. We can provide physical resources to the agency, but we're really trying to do this in a remote capacity. We prefer TERT to do that. We manage things such as disaster recovery. So as an example, we get into the weeds of disaster recovery. If Charleston County goes down and Beaufort County takes our calls, how do we recover our recordings? How do we manage that? So we get into the weeds of disaster recovery. Coordination of resources. Sam will talk a little bit about how we all work together, and we have actual situations where we have done that already. Information sharing and situational awareness. We not only share information through our Alistar information sharing tool, so I can see what's going on in the partners' jurisdictions around me, but we also share information as regarding, as an example, the school shooter, the school bomb threat caller. We shared information about that before we actually received threats here, which made our agency stronger for knowing that that was occurring throughout the country. Technology sharing, we also share technology. We're actually in the process of looking at CAD to CAD, communications issues. We cover pretty much everything in our discussions. We actually had a roundtable with all of our HR professionals as well to talk about staffing and retention and how to better that situation. And legislatively, we feel we're stronger as one voice instead of individual PSAPs. Next slide. As you see from our timeline, we started this in August of 2018. We spent some time organizing. We contract with mission critical partners to actually collect information that would assess our current environment and our requirements and needs for an ESInet. We finally signed our intergovernmental agreements in August of 2019. And then we, as a cooperative, evaluated the ESInet proposals so that we were making the decision on which ESInet provider we would use. We awarded that to InDigital, and then we migrated in April 2021. That's when we began our migration. Next slide. This gives you a picture of our governance structure. We have an executive committee made up of the original members of the cooperative. We have a technical subcommittee and operations subcommittee. Most often they're working together to determine the best technical fix for an operational issue. That includes in how we back each other up. Next slide.
So in these next slides, we're going to go through our ESInet design and what exactly we're currently utilizing our ESInet for. So as you can see here, this is a 1,000-foot view of our current ESInet. Each site is set up very uniquely. You can see everybody has different providers coming in, providing that secure network link, as well as a variety of different links per site. Next slide, please. So as we start going through this, you can see that some, this slide outlines Beaufort and Berkeley, and we'll tackle the others here in the next slides. But as you can see, Beaufort is set up with specifically one primary site with 3 providers in addition to MEVO. And as Berkeley County has their primary and secondary site with redundant links as well. So as you can see, we do have redundant links as well as redundant sites for these first 2 partners. Next slide, please. This is our site here, Charleston County and Horry County as well. You can see that we have 2 providers coming into our primary and 3 providers coming to our secondary. We are exploring a 3rd provider, and that is with Starlink. We have worked directly with our ESInet provider to prove if Starlink would be stable enough to provide that network reliability that we would potentially need for that 3rd redundant partner. We did find that it was successful. The higher level of bandwidth that Starlink provides would provide that need. Horry County, as you can see, actually has 3 sites. They have a primary, secondary, and then their 3rd site for the MEVO provider. Next slide, please. And then Town of Somerville right now just has a primary site with their 3 providers as well. Next slide. So currently today we are routing our location data, text, and voice, which are pretty basic routing. We are looking very soon to route additional data sources over to include video pictures. As Jim mentioned earlier, we are in discussions with our coastal partners to set up a CAD to CAD. So not only would we be sharing those audio recordings as mentioned, as listed below, but also CAD to CAD live data. Our network is built with the redundancy needed. So we do have two geo-diverse data centers, as well as 2 diverse next-gen core service providers. And we are currently testing with geo routing as well. Next slide.
All right, so here's the problem statement, and it's a summary of what guides the Coastal Cooperative. So it's how do we, to the best of our ability, develop a next generation 911 system to ensure that 911 calls always get answered and, more importantly, dispatched. Our ultimate goal here is the citizen that's in need, and how do we connect the responders in the field to the citizens in need. Next slide. So to do that, we're going to go over 2 different backup and failover scenarios that have happened. So next slide. So in May of 2021, we had a 911 outage that impacted 3 total counties, multiple municipalities, and then a portion of a fourth county. So this was early on in the coastal cooperatives, disaster recovery planning and communications planning. But one of the things that we did before this happened was we developed a PACE plan. So the PACE plan is your primary, alternate, contingent, and emergency ways that you'll communicate with other folks that are in your group. So as you can see here, we figured out that there was a problem. There was an AT&T fiber cut or multiple fiber cuts. Immediately, we were communicating at the department head level. We initiated our PACE plan. Berkeley County actually wound up answering the 911 calls for multiple counties. You can see in the chart below how the call volume spiked as the issue grew. But at that time, we used radios to communicate all across the coastal cooperative. And it was very efficient with getting the calls from the call taker back to the dispatch center in need. And then they were able to get their responders en route. During that scenario, we actually had a report of an active assailant at a school, which is something that no 911 center wants to take, but is prepared to receive. And here we got that. We relayed the information to the county that needed the information, and they were able to get an effective response. Luckily, there was no active shooter. So what we learned from this was that we needed to put another level into our PACE plan. Instead of having radio as our primary, our team developed a electronic means of sending calls back and forth that isn't 100% CAD to CAD, but it works very quickly. And we don't have to have one person reading the data over the radio, reading the data over the radio, and another person transcribing it on the other end. So next slide, please. Okay, so September of 2022, we had a hurricane evacuation. So Berkeley County lost power and our generators didn't fire for a number of reasons, but we wound up having to evacuate during the middle of that storm. So with that, we had a few things that went very well, and we learned quite a few things here. So what went well for us, number one, was prior planning. So just like Jim talked about, we're organized so that there's an operations subcommittee, an executive committee, and then a technical committee. Well, that operations committee worked with the tech side, and they had everything laid out so that as soon as we recognized that there was going to be a problem, we were able to communicate. And then when the time came to throw the switch, everybody knew what was going on. So we had Alistar that was involved. We had CAD to CAD with one of our agencies that was involved. And all in all, no calls were lost. That's the big takeaway here. And then we also had MEVO. So we were able to send administrative lines one direction, 911 lines another direction, and all the data ended up back in Berkeley County at our backup center. For our communication side, radio went well, and we were able to conserve our available radio bandwidth because we were getting CAD to CAD and we were getting Alistar. The only time that the radio was really lighting up was when we had an in progress call, something that we needed to make sure, hey, we need you guys to look at this right now. Some of the things that we learned, number one is test the technology. So if you don't test it, it doesn't work. Also, if you only have one thing that's there, one is none and two is one. So make sure that you have redundancies built in. Next is make sure that you validated, while you have blue clear skies, all the different phone numbers that you get from vendors. So we ran into an issue where we accidentally pushed out a number from a spreadsheet, and that number sent calls to one of our partners, and they figured out the issue. They were able to get all the calls back to us, but we had to make sure that it is correct and that you test it on a blue sky day. Finally, test your generators. So every 911 center here should have a generator or some sort of alternate power source. One of the things that got us was the day before the storm was supposed to hit, our fuel technicians here in the county did what every good person does before a storm, and they filled up the generator and they put too much fuel in one of the tanks, caused it to throw an error, and that's why it couldn't fire. We also learned that Alistar works and it should be used more often during our events. And then ultimately where we're headed is our CAD to CAD. So once we get CAD to CAD up and running, that's going to be, well, as of right now, that's going to be the pinnacle of where we're headed. Although there will be steps and things that we can get better after that. And now I'll pass it over to Lori. Next slide, please.
Okay, hope everyone can hear me. So operationally, this of course creates a challenge for all of our PSAPs individually, trying to figure out a way we can help each other collectively. So before we could really assist one another, we had to decide when would we assist one another? What scenarios would cause us to seek help from each other? And that ended up being our 911 system outage. So if someone loses the ability to receive a 911 call, then their calls can be routed to other members of our cooperative who then take that information and relay it back to the agency that's experiencing the outage. So the biggest part of that is notifying one another that there is a problem. And in that instance, you know, if you don't have phones and that takes away one of your means of communication, you have to have some alternatives in place. So operationally, we tried to figure out or identify what are those means of communicating other than our phone system. So radios, as Sam has mentioned, that ended up being our most direct way to communicate with one another and immediate. Cell phones is also another way in which we communicate. And then he talked about Mevo phones, which is another way we can communicate if our 911 system happens to be down. Basically, if they can be connected with an IP connection, it gives us another way to call one another. We are still actively seeking other available resources to communicate, text messaging, anything like that. We're still figuring out what works best for us collectively. Next slide. So once we get these calls from one another, our biggest obstacle is how do we process them without causing disruption to our floor? Because we're all going to be taking our normal calls in addition to whatever calls we may be receiving from other agencies. So we didn't want to disrupt that telecommunicator. So we all follow our own current call processing protocols. So if one agency has a particular set of protocols that they follow, then they follow those same protocols when answering 911 calls regardless. That way that telecommunicator is not confused. They follow their same protocol to process that call, and there's very little disruption other than basically answering more 911 calls. So once they take the call, then we had to get the information back to whatever agency is experiencing the outage within our cooperative. And they mentioned Alistar earlier, and there was a web-based program that we all had to, we can enter information into. So for us, some of the agencies were already familiar with it and others were basically learning of this and utilizing it for the first time, but that form allowed us to pass information back and forth. Once that agency who is experiencing the outage sees a call into the Alistar form, they realize we have one, they can then take that information and then dispatch that call accordingly to their processes. Next slide, please, and I can show you the example of the form. So it's very basic, and we try to keep it simple so that when our call takers are putting information in this, they're not overwhelmed by the amount of information they're adding. So you can see with the form, we really just had it very basic. Who takes the call? That would be the call taking agency. What is the location of the call? The type of call that it is, and we kept that simple. It's either going to be police, fire, EMS, the address, the information about the call itself. And then down at the very bottom, there's a call status. And there's an option there we can choose that says either pending or complete. So if it was pending, then you knew that information just got added to the form and the other agencies can look at that. And then if it's got complete, then the agency that is responsible to dispatch that call sees that it's been completed, and the agency that put it in knows that they've received it as well. So that kind of closes that gap, and we're not wondering, did they get the information or did they not? So very basic form, and it served its purpose. And like I said, we are still modifying things and working on things as we do practices and tests. But for right now, when it was necessary and needed, it did its purpose. Next slide. So there was some training and testing that has to go along with this, and there will be continuing training and testing that we do as more technology comes into play. But basically, we had to make our telecommunicators aware that how do they get to the radio channels they need to talk on, how to utilize that Alistar form. There were some logins created, how to log in, and internally we're kind of forming our own tactical emergency response team so that, we can take those folks that as a supervisor, this person is going to be able to adapt very quickly to any situation you throw at them. So we make them members of our emergency response team so that, let's say, for example, Berkeley loses their 911 system and calls are routed to Charleston, then if we have members available on that tactical team, they can jump right in because they're familiar with things about each agency. And that is part of our training, is to have those members be trained on various operations of each other's PSAPs. So being that they're already familiar, they got a better understanding of what needs to happen, and it allows them to function a little bit better during that scenario. As far as testing, you got to have some mock outages. We learned a lot in some of those. We performed one at the end of March, and basically it just simulated an outage. That so-and-so was down, and this is what we've got to do. And we started entering calls in and walked ourselves through the process. And it does give you some insight into what can you do better. And that's what we're continually looking at. We do weekly radio checks right now that just allows everybody to switch over to the proper radio channels, talk to one another, acknowledge each other on the radio. And we do that kind of to correspond with some nightly radio checks we already do. We also do them during the daytime once a week, so that if some of our members have steady day shifts or steady night shifts, all members of their team are able to participate in those checks. And then hopefully once we are made some modifications to the Alistar form, we want to incorporate that into our weekly checks as well. So when we perform our weekly radio check, we would go ahead and perform our weekly Alistar form testing along with that radio check. Just gives everybody practice so that when you're logging into that and utilizing that form, it's not, your first time isn't when there's actually an outage. And that seems to help us quite a bit. So basically, we're able to get this information back to one another and dispatch within most of our own protocols so that we're not asking our telecommunicators to do something brand new. We continue to meet, figure out better processes, what can we do better. So this is something that will never, as technology allows us to do more and more with 911, we will continue to adjust our processes to basically figure out how can we help one another. And that's all I have. So I guess we go to some questions here.
Hey, thank you very much. Thank you, Lori, Sam, Jim, and Matt. We'll go ahead and start our questions now. I think the very first question that I saw pop up a couple of times is, can someone define what MEVO, the acronym MEVO, stands for and how that operates?
Yeah, so MEVO itself is defined as its message evolution. So essentially it's hardware that is provided by our provider in digital, and it's essentially a device network, diverse network that allows us to transfer calls. So for example, if we needed to bug out of our primary center, we can quickly with MEVO device bug out and route all of our calls to our backup center. And we can also route calls to our partnering agency. It's pretty lightweight, but there is some hardware that's involved with it as well.
All right, great, thanks. So the next question we have is, are the various counties in agreements with other PSAPs outside the cooperative who might share a border or other common space?
Jim, do you want me to take this, or do you want to take it?
No, I'll take it. So we work with our partners that are bordering us, but they do not share our ESInet. So this cooperative is really about not just providing automatic and mutual aid, but managing the ESInet that we partners are using. So there will be other partnerships developed. It probably won't be part of this cooperative, but that's, at this point, we are working with the other surrounding counties.
Okay, great. Next question I have for you is, what system are you planning to use for the CAD to CAD interoperability?
So we had mission critical partners develop a scope of work for us. At this time, we're trying to determine whether we have an existing vendor relationship that could provide that, but we may end up going out to RFP for that as well. Currently, though, we're using Alistar, and that is a commercial product. It's an information sharing tool to share information amongst the partners at a very basic level where we can view. And as you can see, we can exchange the form as well. So Alistar for basics and potentially an RFP if we don't have an existing partner that can provide that.
Okay, great. Next question for you, Jim or Sam, is, has the consortium decommissioned all selective routers serving the consortium?
Hey, this is Sam. Right now, no. And the reason for that is we have a couple of agencies that are still in the transition process. And as a part of that transition process, we have to get all of the carriers to migrate from the existing selective routers over to the ESInet. And until that happens, and we have a period of time where there is no usage of the selective router, we have to leave that in place to ensure that all 911 calls get answered, regardless of the method that they come in.
Okay, and a follow-up from the same person is, calling your network an ESInet, which core services are you deploying across your network?
So today we're routing voice, text, and location services across, with anticipation soon of video, pictures, and our CAD to CAD will route across it as well.
For just a couple more. Is Alistar filled out manually, or can the CAD help fill it out?
Today it is a manual entry. The goal is actually to work reverse. If we end up having still to use that form, the goal is to actually have the form create a pending call within the CAD for that responding agency.
And this last question, I think, relates to Alistar, but I'll ask it. Would you be able to elaborate on the solution you added to your PACE plan to pass information among ECCs, not through the radio?
Yeah, sure. So Alistar in itself is a product that is we have from ATI. And essentially what it is, it's a situational awareness software that allows us to bring in disparate data sources to include CAD data. From a SQL, you could bring in all your Esri REST services, cameras, just a host of information, and share that into one situational operating software. In addition to that, you have forms, and that is exactly what Lori showed here, was one of the web forms that we can create. That web form also creates a layer within the map as well, so those calls can be seen on the map, not just looked at on the form. And there's also a table view behind that as well.
Well, thank you for answering those questions. As we mentioned earlier, all the remaining questions, as well as the remaining questions from the FCC presentation, will be answered and posted online when we post the this on 911.gov in the next couple weeks. So this concludes today's webinar. We appreciate and thank all of our speakers today. An archived version will be available soon, and the next webinar will be on Tuesday, July 11th, 2023, with a presentation detailing PEMA's online PSAP data gathering and cost projection portal, and discuss their efforts with PSAP regionalization in the state of Pennsylvania. We hope you all will be able to join us. Thank you and have a great day.